I started with some left-sided pain. I had my daughter-in-law bring me into the ER here at Crossing Rivers. Much ado to some test workup, they found that there was a adnexal mass on my right, what they thought was ovary. My pain was getting worse, and the mass actually grew from October 2nd to November 2nd. So I saw Dr. Benden, who is an OB/GYN. I actually went into surgery that same day that I saw her, which we kind of were expecting. So we were prepared. My husband and my daughter came along on this journey. When I went to surgery, again, the surgical crew informed my husband and daughter the whole time what was going on, how I was doing. To when I came out post-op, Dr. Benden came and talked to me again and just asked, made sure I was comfortable, I was doing okay. And then Dr. Benden came in and talked with my husband and my daughter also and explained everything and in layman's terms so that they understood. It was just fantastic. It made me feel comfortable, it made them feel comfortable in a very trying time. It was just a remarkable time for me to just see. I'm very happy and proud where I bring my students. That's what I expect, but to have it in return made me so much more comfortable and made my family comfortable that I can't explain the gratitude I have for Crossing Rivers. They did take out both my fallopian tubes because inside my fallopian tube was a mass, and they had to send that with some cyst to pathology. So for 2 weeks we were on this unknown of we didn't know what was going on. 2 weeks after that, I saw her on a Monday, and I had a full release from her. Pathology came back fine, which was a sigh of relief for all of us. And that Saturday morning, early morning hours, I started having a pain. My gallbladder went out. And with that going out, I also came up with pancreatitis. And I did break down, and I have to say, Angie, who was the RN that night, gave me some tissues and held my hand and just say, is there anything I can do? And I said, nothing. There's nothing you can do. She just let me share my emotions and help with, just making us feel comfortable. And we knew we were on a difficult journey again. They did ask if we wanted to be transferred. And with my prior experience here, I said, no. For my family, I would prefer to stay at Crossing Rivers if we can at all. Bless his heart. Dr. Holmes happened to be the hospitalis that day. I was sent up to the med-surg floor and I was admitted, which was wonderful because, like I said, I know the staff. I know their compassion that they display at Crossing Rivers. Again, I cannot reiterate how happy I am and proud I am I can bring students here to see that, because again, it's something we cannot teach. You either have compassion and empathy or you don't. And they have a pure display of it here. And it's not just the nurses. It was housekeeping, therapy, Dr. Holmes himself, the nurses. Every person in this hospital was accommodating and, do you need anything? I don't want to bother you. However, they kept me going too. They allowed me quiet time, but they had things they had to do too, but it was not anything that interrupted my family time. My husband stayed with me those days, and just the compassion that was shown to him as well, because yes, I'm a patient, but he was there as my support, and they made sure his needs were made. So I can't stress enough how happy and grateful we are to Crossing Rivers, how honored I am to bring students here from Southwest Tech so that the nursing students can go what I feel is important too, care. We care for our patients, and truly Crossing Rivers cared. It's a wonderful place to bring family. It's a wonderful place to, if you have any needs, emergency needs, hospital needs, surgical needs, I highly recommend Crossing Rivers Health, because for my family, that was the most important, is I was close to home. They could come see me anytime they wanted, and everybody allowed them. Even my grandchildren came, and they made sure that they were taken care of as well.